So this is ibis.health.utah.gov. And this is the database for Utah's public health information. And what I'm going to go over is what information you could find. And down here, it shows a basic list of the information that you could search for. You could search for various health topics. And if you click on that, or this button, this tab up here, you could find birth and maternity. And so when you click into there, there's additional information. Why it's important, who's at risk, how it's tracked. So PRAMS is a monitoring system that Tong will go over in the query section, and indicator reports that are related to maternity and birth. So some of these are probably familiar to you in some of the things that you've been studying. And so we also have queryable data sets. But the difference between indicator reports and queryable data sets are the information here is set see that one is updated. So we could do obesity and pregnancy. So the indicator report for obesity and pregnancy will show you a graph here. And you could also find the lower and upper variation for that. And there's also other views. So you could search Utah information by race, ethnicity, county, or small area. So we could do try race right here. And so it's that same information, but just the indicator displayed by race, just the same information. So what Tong will go over later is how you manipulate the data with the query. Let me go back to the home page. So we looked at the health topics, which is right here and right here. That showed all the pictures of the different health topics you could look for. The health indicator reports list here are, you could search for a certain topic. So like earlier, we found the obesity, so we could search by using Control F. So obesity and pregnancy. And so that will show the indicator. And that's kind of what the indicator showed in the health topic indicator list that we saw. So I prefer to use the alphabetical health indicator list report because I know what I'm looking for usually, or if I want to find something related, maybe let's see, fetal, I could search fetal and then find this right here. And so those are what the programs have updated as far as health indicator reports. Okay, so preterm birth is another one. And so this health indicator is going to show you the important facts about preterm birth in Utah, the rates going on, and which methodology is being used for it. So if you have to cite it, you could go to the bottom and see these sources and any data interpretation issues and notes like it showed here. So that's, let's see, preterm births less than 37 weeks with Utah and the US through 2019. So we could look at another view with the same information, maybe look by a local health district. So Utah is divided up into different health districts. And the Utah Department of Health is located here in the Salt Lake Health District. I live in Tooele County, so I live out here somewhere. So our rates are going to be different. And so these bars in the chart are going to show the higher and lower, and also like the, let's see, yeah, the percentage for the local health districts. Let's see, percentage of live-born infants. So that's what this is showing. And then it also has this data table here and additional notes. And if you want to click a full report, it will show you the numerator, denominator, and all of the information for this indicator and related graphs to it. It will show you all of the graphs for this indicator of preterm births. Okay, and then next I will show you the community snapshot. So we've gone over kind of the home page here where you see the different tabs on the top or different search options down here. So in the community snapshot, you go to community report selector. And you could also go into the introduction to learn more how to use it. But if you go to the community report selector, you're able to find a report that you want to search for. And if you're doing the whole state of Utah or want to click one local health district or get into more detail and find a small area, you just click the location that you want geographically. And so I'm just going to click, let's see, Tooele County because I live here. And the set of health indicators I'll use, so related to your study, would be probably women's health indicators. And it could be into other measures, but we'll just click women's health indicators for now. And submit. So this community snapshot tool will allow me to select Tooele County and view women's health indicators, comparing the Tooele County rate to the state rate. Sorry about that. Okay, so at the bottom there's a legend and it shows that the green check mark is it's better than the state rate. The yellow squiggles are about the same as the state rate, and then the red exclamation means that this county or this election is worse than the state rate. So let's see. So here's a list of infant mortality from 2017 to 2019, preterm birth, obesity and pregnancy, what else is related to maternal health, gestational diabetes. So you could easily find the rate was 6.6 against the state average of 6.3. So that's how you would interpret that. And then next we have our publications. So you just click this publications tab and you could go to chronological, which shows the most recent publications. And there's a lot of maternal health reports in this, or you could go to topical publications. And I'll just share the link really quick. Let's see. We could go to maternal and infant health. And so, let's see, the most recent one was postpartum depression among adolescent mothers. So this was out last month. And so this is updated information that shows data, Utah data specifically, and a report on it. So this kind of, so Tom will go over the PRAMS survey in the query module, and that stands for Pregnancy Risk Assessment Monitoring System. So there's many reports written already of the data that's in there. If you look here at applications. Yeah, lots of valuable things there. Let's see, and then there's also a women's health. So we're in publications, searching by topic, and there's maternal and infant health, and there's also women's health. So you could search and read any of these publications, kind of reports. It's kind of like a news article of our program's updates of their most recent information. And then last for me is the health indicators, and pretty soon we'll have a health indicator tab up here like we do for health topics and data portal publications. But for now it's in the data portal, and you just click the health indicators. And you could use, actually, it could be kind of easier. So you could select from here if you want your health indicators alphabetical or categorized. I showed you the alphabetical list already that we could search by clicking Control F. And up here, you could search for any topic specifically that you're looking for. Or if you kind of know the category to look in already, you could search the categorized selections. So here's some women's health indicators, women's health issues. And then that's how you would find the ones related to what you're searching for. All right, and if you want any other information on the methodology and guidelines, the resources and then methodology and guidelines page could help you find how we're measuring everything, including the boundary definitions for the Utah small areas that are split even smaller than the local health districts. And that is all I have, and I could pass it to Tong for query.
Okay, let me share my screen. Can you see IBIS screen?
Yep.
Okay. Okay, so I'm going to go over the data queries. So So the IBIS query system allows the general public to access the public health data sets and generate the query results based on your specifications. So you actually interact directly with the data set through the interface. Then you can get the data table by doing a dynamic query. So let me show you. Here is data sets available on IBIS. So for the query system, actually, we provide the public portal, which is what you see here. And also we have a secure data portal. Under this portal, we have data with a more refined geographic area, like a zip code level, census tract. But you need to apply for access in order to access the secure data portal. And also the My Query, that's another part of the query system. So under that, you will have a saved query. So I will show you what's the saved query, and also will record what you have access to the secure data portal. So let me show you one by one. So here is the data query public portal. So that's all the data sets available to public. Let's try, I pick one you might be interested, BRFSS. So this is a survey data, and on each data query system, we always have some most frequently used statistics. So of course you can do something else, but what we have here is the most frequently used. And under each of them, that's the BRFSS questions. So I think you should be interested in the PAP test, this one. So you just select this question, which is a accrual rate. And you will see this, we call that query builder page. So on this page, you are able to filter on whatever the query you want to do. For example, like here is the focus value you want to look at, and that's the year available to this measure, and also the age. And the age, you can enter the customized age group, and also we have a predefined age group there, and also the sex variable and other demographic variable. And also you can select another BRFSS indicator to cross by this, whatever the question you're doing. Right now we're doing this, the PAP test. So you can cross by another questions, whatever, say here, like heavy drinking or something like that. And also we have geographic area available, local health district, urban, rural, and the county, and also Utah small area. So that's a 99 small areas. Also, we have this measure called Health Improvement Index classifications. And also on the last step, you should be able to cross by your results by up to 2 variables. So you can select any 2 variables to do the cross tab here. And also, if you want to see a map, then you need to only display by geographic area, because map only display by geographic area, right? And the none need to be here, because map only display by geographic areas. Let's do one query. So I can show you what's the step-by-step flow. So we want to look at, most of the recent 2 years, age, let's do this many. maybe not that. And you can select whatever the demographic, but I leave those blank for now. And let's do by small area. So I want to see a map, so I leave this here. So submit. So after you submit your criteria, you get to the result page. So here is the map, small area maps, and by all the small areas. And on this page, you will see the metadata, like what you have done for this query. And also on the bottom, you will see the data node, which is the question asked, and whatever we need to note this data, and also the data sources and the data issues. And also you can see when you did the query on this one. And on this results, you can do map, and also you can do something else. You can do the chart. This many, let me see if I can do one. Vertical bar. So this is the bar chart for your, I mean, for my query results. And also on this page, you can do my saved query, which means next time if you get into this query, you don't need to enter those criteria again and again. You just save whatever you have defined here. So you say save query definition. And you need to have account, any account. You can just, you have to register for this feature. Oh, what's wrong? Why it's not? Oh, okay, so I get into here. So, oh, this is my secure selection, but I want to save the query. So this is my another saved query last time I did. So it's saved here, but I want to save the current one. Why? Oh, I need to log in first. Then let me do it again. So BRFSS, crude rate, current, and the prep test. I want to look those 2 years. Okay, see, okay, still there. So I submit the query. I want to save this query. So save definition. So here is the saved query, and you can name it and call whatever you need. So let me put demo there. So I know it's this one. Then you just save it. So see, this saved query is here. So next time you get into my query, you can just click on that. You don't need to enter those criteria again. Then you get what you have. Oh, did I select those? I should have those. How come? Let me do one more time. This one, age 1. Display by small area. Okay, so I want to save this definition. There So this is the one. So next time you click on this, yeah, it's bring back all the criteria set. So this is the saved query. If you have a very complicated criteria, so this is very, convenient tool you can use to save your query. And also for on this result page, you can export this data table to Excel. So if you click on that, it will take you to Excel. So you can save the data table and then manipulate the data, in the way you want. Yeah, so it's in Excel. And also for saved query, you can only, you're not only do on this page, on the query define page, the builder page, you can do that, the same thing. You can save this definition here or result page. So you have two places you can save this query. So this is for the public portal. But for the secure portal, you need to apply for the access. So this is what I have. Like cancer data, you can have that, and the birth data by zip code. So those are available secure portal. And yeah, and also for the my query, that's the for the my data here. For the my data here, that will store two types of your data. One is the secure data portal, the module you can access, and also the saved query there. So this is a saved query and a secure selection index. That's my secure query. So I think that's all for the query system. So any questions? I think you can look at the params. There are many, this is survey data too. So there are many questions may be useful for your study. So same thing, if you do those and just the step by step and get into the result page and see what you want to do.
Yeah, and the information goes back pretty far, doesn't it, Tong, in some of them? Or you could select newer data versus older data, I think.
For which one?
For some of the queries, like it says pregnancy intention 2012 and older, or 2012 and newer.
Oh, yeah, that's because of a survey question has been changed. So we have to separate them. Like here, we have to separate them because the question has been changed. Or yeah, there's some changed and the year they're different. Is that your question, Benji? What's your question? Yeah.
Yeah, I was just pointing out that some of it newer data or some of it's going to be older.
Yeah, you can play with it, and if you have questions, you can always email this, right, Benji? This is the email.
Yep, you could email.
Yeah, just ask us questions about it.
Yeah, we'll be happy to help out with whatever report you're trying to build. And with the queries, what's really cool is you could build on so many layers of information that you're looking for. And that's the opposite of like the indicators that are kind of set.
Yeah, you can select the which year and the age, and there are many other demographic variables here available to be queried. But this one, we don't have geographic area, I don't think, for params because of the small numbers.
Mm-hmm. But we have some like folic acid consumption and like the PAP test in the BRFS.
Yeah, and also the birth data, I don't know if it's maybe there are a lot of information you need, but you can just go there and see what's available there, like birth data. Yeah, you do have this many choices here. And infant and healthcare characteristics. Yeah, like those 2008 and earlier and after later, that's because of this variables measurement has been changed during that year. So this is for birth. And also I think you might be interested in the fetal death and infant mortality. We do have infant mortality by major causes. So let me see. Yeah, this one we have some cause of death for infant mortality. Do you have any questions? So I can see if we have those data available here.
There is one from Margaret in the chat.
Yeah, I was wondering if you have data on miscarriage rates.
Which one?
Miscarriage, like premature, like the early loss of pregnancy before 20 weeks.
Mm-hmm. You mean which data set you're asking?
Oh, I'm not sure which data set it.
Oh, you asked me.
Yeah.
Miss Kerr, I don't think
mortality.
we have that data set. I don't know if fetal death. Well, fetal death is not. Well, I don't think we have a data set. I mean, at least on IBIS to have that miscarriage information.
What is fetal mortality defined as? Like fetal death at what point? Is it 16 weeks gestational age, 20 weeks gestational age?
20
I think
weeks.
it's 2024, yeah.
Okay.
Oh, 20 weeks, okay.
Yeah.
So, but you don't think there's any information on pregnancy
Miscarriage.
loss, yeah, before 24 weeks?
No, on IBIS at least, I don't think we have. On PRAMS, do we have that on PRAMS? I don't think so.
There's a couple options of abnormalities or fetus affected by maternal complications of pregnancy.
Which one, Benji?
It's fetal mortality.
Oh, fetal mortality.
Yeah. So the select, yeah, the bottom one. So that one shows the cause of death.
Yeah.
Right, but there's a stark difference between cause of death after 20 weeks gestation as opposed to before 20 weeks. So,
Yeah.
I mean, it's been
You know,
really hard. Like that's what I'm doing my research on, and it's really hard to find any data on miscarriage rates at all.
Yeah, it's, and also, you know, Benji, where is that data store page? So we don't include all the variables on IBIS for each data set. If you have more questions, actually, you can go to data stores to ask them. Sometimes they may have, but I think it's under.
Do they collect information on history of miscarriage? Like if I wanted to look at postpartum depression and, you know, link between like, you know, previous history of miscarriage, would they collect that information, do you think?
I don't know. That's why probably you want to ask data stores. They know data the best. For me, they just give me those data set and variables they want to put on IBIS. So if they're not in this data set, doesn't mean it's not in their data set. You know what I mean? So that's why I want to find that page, contact information. Benji, do you know where is that?
The page to link to the maternal and infant health program, but I'm not sure if this is their newest website. Let me.
I need to find that. contact. Oh, here, data set and the contact list.
Okay, yeah,
So-
so I do remember the postpartum depression report in the PRAM survey.
So maybe you
And I
can ask
believe-
PRAM's data store about your question. They can always have some new questions, but they haven't given me on IBIS yet. PRAMS, where is the PRAMS?
Yeah, and, let me find the link to some data reports that they've put out in their own program outside of IBIS. So that could be a resource too.
Yeah.
But yeah, that's a really great question, and I'll ask the program and see if that could be a specific BRFS survey question, since that's what a lot of people are searching for.
Yeah.
I have also a question.
Yeah,
about-
Lori asked you the one.
Sorry, can I go ahead with my question?
Yeah.
About the secure data, how long does it take if somebody asks for the secure data to have access to the data, and is there any fee involved?
You mean how long to get access?
Yes.
You need to go here, apply for, because all those secure data, they are owned by ePhD program. So you need to go through this process. I don't know, probably won't be long,
Thank you.
like a week, something like that. Yeah,
Thank you.
yeah. Any more questions? You can just get into those data sets and see what's available there. So maybe you will find something useful for your study. I think probably the birth, this part, birth, fetal mortality, and the infant mortality, and the birth defect. And the infant mortality actually is not just the mortality data. We have this linkage, like birth death linked infant mortality. So you will get mom's information from birth data. So you can get those information from here.
What about data on sexually transmitted diseases? Is there
Oh,
any information?
We have communicable disease. Communicable disease, this module. We do have, yeah, we have those. And also we do have a secure module for that with some geographic area.
From the environmental
Yeah.
public health.
No, this one is different. This one you have to apply for communicable disease access. That's different.
Okay.
They're owned by communicable disease. And and also under that, we just have COVID data up. So.
Yeah, there is a lot of information here. So
Yeah.
you could search probably.
For the data query part, probably before we call that advanced user, they get into here because they need to know a little bit about which data set has what information in it. So yeah, so if you don't know, you can always ask us, and if we don't know, we can refer you to data stores to answer your question.
Yeah, and I'll ask about the miscarriage question because I think for me, I think that's a survey question that people could answer yes or no, or time of it happened or all that. And then a follow-up question like, did you suffer from postpartum depression after, or how long after? So those are good questions, and you're always free to ask the program. If you go to, let's see, about.
I think it's here.
Yeah, the contact
Your
list.
data set. And also
You can
there's some
always just email. We're happy to forward your email to any of the program experts. But you could search the contact person here. And then, yeah, because I talk with Nicole a lot. She does a lot of publications with the maternal data. So that's a good question. I'll ask her. So thanks for asking. So is there any other questions anyone has? Okay, cool. Well, I hope it's not overwhelming, and I hope you love IBIS like we do and like Logan does. And I promise you, it will get easier the more you use it. And the more, like for me, I even worked here running the IBIS website, and I didn't even know where the health indicators were because they were hidden in the data portal. So we're going to make a separate tab for that. So if we're looking for specific things, we could just select them from the tabs.
Yep.
But yeah, feel free to explore it and just play with data and do all kinds of searches.
Yeah, and also feel
And don't-
free to contact us for questions. If we don't know, we will forward your question to the right person.
Yeah, exactly. All right, well, thanks so much for letting us visit with you, and good luck.
Thank you very much, Banji and Tong. We do appreciate your time, and I'm sure we will get back to you with some questions because the students are going to do assignments on IBIS data set, and hope we can get some data snapshot to be published with Utah Women Health Reviews, which is published by University of Utah. So this is a good chance for all of us in Utah and University of Utah to get familiar with health indicator of women and children using the data set of Department of Health. We do appreciate your presentation. Thanks a lot.
Yep, you're welcome.
Thank you. Bye.
Thank you. Bye.
Bye. So, hello everybody. I am happy that it worked smoothly. I was just worried if we have again data screen share problem. So I would like just, first of all, any question from our first session? Did you find your way easily through Canvas, through the material uploaded? If anything, please put me in the chat. And I would like